Hello. This week in lab, we are talking about cranial nerves and discussing their function, discussing how to test them. So let's talk about a little bit of background information. So remember that the central nervous system is the brain and the spinal cord that comes from it, right? The other part of the nervous system is the peripheral nervous system. Remember, periphery is talking about the stuff that's around this main thing. So the peripheral nervous system consists of all the nerves that come off the brain and spinal cord and innervate the rest of the body. The cranial nerves are a part of the peripheral nervous system. They happen to be the nerves that actually come off of the brain. So these are the cranial nerves. There are 12 cranial nerves in total. Just a little bit about the cranial nerves before I get into the more specifics about it. One is the cranial nerves usually have two names. Some of them have three, but the cranial nerves are named for their number. So you have cranial nerve 1, cranial nerve 2, all the way through cranial nerve 12. And they are numbered actually sequentially from their location. So it starts anterior to posterior. The first one that you come to is cranial nerve 1. The second one is cranial nerve 2, etc. It's also named for their location or what they do. And I'll explain that to you as we go through it. So just keep that in mind as we talk about the cranial nerves, that part of what is going on with the cranial nerves, or the naming of the cranial nerves, is where they are or what they do. So that actually helps you remember it a lot more easily, as opposed to them having some random name. So just keep that in mind. So now I'm going to share my screen and I'm going to go through all the cranial nerves with you and a little bit of other information, and then explain to you what we were doing today in lab. So give me just a moment. All right, so these are the cranial nerves. Like I said, there are 12 cranial nerves that you'll need to know. And once you get into it, they get relatively easy, but there is quite a bit of information for them. So let's get to it. When you're talking about the cranial nerves, you're not only going to talk about their name and where they are, but also how they function. So some of the cranial nerves are sensory nerves. Some of the cranial nerves are motor nerves. Some of them are sensory and motor, meaning the ones that are sensory are the ones that will go to your sense organs, like your eyes, your ears, right? And your motor nerves will have you do something like move a muscle or have a gland secrete or something like that. So as I go through the different cranial nerves, I'm going to tell you which ones are sensory, which ones are motor. And again, we'll talk about it a little bit more a little bit after that, but I just wanted to give you a heads up. So cranial nerve 1 is your olfactory nerve. Olfactory refers to your smell, right? It talks about smell. So your first cranial nerve is the nerve that is a sensory nerve for smell. This was really important in the last couple years because we had so many people who knew or found out that they had COVID because they lost their sense of smell. Well, sense of taste and smell, but especially their sense of smell. So I am assuming that there was some potential viral infection in this nerve that would have caused them to lose their sense of smell. That's not always the case, because it could actually be an issue with the nose itself and not the nerve, but this is one of the things that as a practitioner you would want to keep in mind. So olfactory nerve, cranial nerve 1 is a sensory nerve that sends your brain information about smell. Cranial nerve 2 is your optic nerve. When you hear the word optic, think of the eye, like optician, right? Or optometrist. So this is what the optic nerve does. This is your sensory nerve sensory nerve that involves your vision. So if you have a problem with your sensory nerve, your cranial nerve number 2, then you will have a problem with your eyesight. This is the nerve that your ophthalmologist or your optometrist is testing when they do that vision eye chart. All right, so cranial nerve 2, sensory nerve for vision. Cranial nerve 3 is called the oculomotor nerve. So when you see ocu or oculo, also think about the eye, because that is another word that talks about the eye. So the oculomotor nerve, if you just didn't know anything else, you look at the word, it talks about, because now you know that oculo means eye, oculo, eye, motor, movement. So this is a nerve that has a motor function for eye movement. Now this does this in 2 different ways. The first way is for the eyeball muscle function. Your eyes each have 6 different muscles located, sorry about that, located around the eye that help your eye move in all the different directions. So side to side, up, down, diagonally. Those are controlled by eyeball muscles. Your oculomotor nerve controls 4 of those 6 muscles. All right, so that's a motor function. The other function that it has is pupillary response. So when you're going into a dark room from a light room, or going to a light room from a dark room, you know, your pupils have to adjust, they dilate, they constrict, so that it can control how much light actually gets into your eye. This is why if you go from a dark room to a light room too suddenly and the room is too bright, it will feel very uncomfortable, because your pupils have not had an opportunity to accommodate to that level of light. And you got too much light that hit your retina in the back of your eye, and it doesn't feel comfortable. So your oculomotor nerve is the one that's going to sense all of these things and allow your pupils to constrict when you go to a light area, and dilate when you go to a darker area, so that you can get as much light in, so that you can potentially see in the dark. So that is cranial nerve 3, your oculomotor nerve. Cranial nerve 4 is your trochlear nerve, and it also innervates one of the eyeball muscle nerves. I'm sorry, one of the eyeball muscles. It is the superior oblique muscle. This is the one that allows your eyeball to move downward, outward, and inward. So yeah, downward, down and out, and inward. Those are your superior oblique muscles. So obviously this is another motor nerve. Cranial nerve 5 is the trigeminal nerve. So remember that T-R-I means 3. So your trigeminal nerve has 3 branches, and your trigeminal nerve innervates your face like this. It has 3 branches. You have the top branch that is the ophthalmic branch. Ophthalmo also means eye. So think of ophthalmologist. The ophthalmologist is your eye doctor, but this is the eye doctor that can actually do eyeball surgery. So your ophthalmic branch is the one that innervates your forehead, your scalp, your upper eyelids. You have your maxillary branch that innervates your cheeks, your upper lip, and your nasal cavity. And then you have the mandibular branch that innervates the ears, the lower lip, and the chin. All right, so these are the 3 branches of your trigeminal nerve. You have next, cranial nerve 6 is your abducens nerve. The abducens nerve is the last nerve that is innervating one of the eyeball muscles. So your abducens nerve is responsible for your lateral rectus muscle of your eyeball. This allows you to look outward. So for me to be able to look out on this side will be lateral rectus, on that side, lateral rectus on this eye. So obviously this is another motor nerve. Cranial nerve 7. Cranial nerve 7 is the facial nerve. This is both sensory and motor, and innervates your face. So it allows you to have facial expressions. It allows you to have a sense of taste, so your sensory. right? Sense of taste. It supplies the glands of your neck and your head. So your salivary glands, your tear glands, and the communication sensations, so another sense for your outer ear. So sensory and motor for your facial nerve, innervating a good bit of your actual face. Cranial nerve 8, vestibulocochlear nerve. So the vestibulocochlear nerve is one of the ones that has multiple names. Sometimes you'll see it as the acoustic nerve, sometimes the auditory nerve, sometimes the auditory vestibular nerve. So be familiar with all of these because those are all interchangeable. But remember that acoustic and auditory mean hearing, right? So the vestibulocochlear nerve is the one that is responsible for the little bitty organ in your ear that has two functions. One half of it is responsible for your hearing, your sense of hearing. The other half is responsible for your sense of balance, your sense of balance. So sensory nerve for hearing and balance. The cochlear portion is the portion that will receive sound waves, process those sound waves so that you can actually hear. The vestibular portion is the one that what am I trying to say? That is responsible for your sense of balance. So when you close your eyes and you turn, say you are being tilted from one side to the other, say like in an airplane, or you're, moving forward, moving back, your sense of balance, you're able to know where your position is in space and to be able to keep your position because of this vestibular portion of the vestibulocochlear nerve. All right, so vestibulocochlear nerve is hearing and balance, and please be aware of all of the other names of this organ or this nerve. Cranial nerve 9 is glossopharyngeal. So glosso means tongue. Glosso means tongue. Pharyngeal, of course, refers to the pharynx, which is the back of the throat. So your glossopharyngeal nerve is both sensory and motor and has to do with sending sensory information from your sinuses and the back of your throat, part of your inner ear, and the back of your tongue. It also provides part of your sense of taste and the vibratory movement of the back of your throat and one of the muscles in the back of your throat. So that is your sensory and your motor for the glossopharyngeal nerve. Cranial nerve 10 is your vagus nerve. The vagus nerve is the most diverse of your cranial nerves. It's also the longest of your cranial nerves. This is the only cranial nerve that actually goes from your head and travels all the way down into your body, through your body, into your abdomen. It innervates things all the way through. It's sensory and motor. So it has functions in your head, your ear canal, parts of your throat, but it also goes down and innervates everything along the way. So in your chest, it has function in your heart. In your abdomen, it has function in your intestines. So just keep that in mind, that your vagus nerve, very long and has function in several different parts of your body. Cranial nerve 11 is your accessory nerve, or also called the spinal accessory nerve. The spinal accessory nerve is a motor nerve that controls the muscles of your neck. So it is responsible for you being able to rotate your head side to side, being able to flex down, extend up, lateral flexion to each side. This is your cranial, your accessory nerve. It also allows you to shrug your shoulders. All right. And the hypoglossal nerve. So you already know that hypo means below or low. And you just found out that glosso refers to the tongue. So this is the nerve that innervates the tongue. I guess it goes underneath the tongue. Anyway, so hypoglossal nerve is the 12th cranial nerve, and it is responsible for the movement of most of the tongue muscles. So a motor nerve for the tongue. So those are basically all of the 12 cranial nerves. and their function, and whether or not, or where they work and what they do, whether they're sensory motor or both. So now, so the next page, on the next page, and this document is on Canvas already, so it's available for you. You can download it, print it out if you want to, or just read it and use it how it is. On this page, I wrote some mnemonics for you to be able to use to help you learn it, retain it, so that you can bring it back up when you need this information. These first four mnemonics are each of the first letter of, let me rephrase this. The first letter of each of the words of these four mnemonics corresponds to one of the names of the cranial nerves. So you notice that all of them are O, 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 T, T, A, etc. And that corresponds to O, 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 T, T, A, etc. So pick one of the four. You don't need all of them. Pick one of the four, whichever one resonates with you the most, and memorize it. Now, that's not to say that you can get away with not memorizing the actual names of the cranial nerves. That's not the case at all. Because even though this is helping you know which ones go first, second, third, you also realize you have 3 O's, you have 2 T's, you have a couple A's. So you really do need to know these cranial nerves. This is basically just there to help jog your memory. All right. So it is not unheard of, and it is widely accepted, at least for me, that if you are taking a test and you want to write this down on the side of the page before you get started, please feel free to do that. I did it in medical school. My friends did it in medical school. So it's not unheard of. So if you need to, like soon as you get a test, write O, 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 T, T, A, and write that down the side of the page, then feel free to do that so that you can, have your memory device on hand. So that is these four, all right? And that's how these four work. Now, this next one, memory device, is one that a student showed me because I didn't even know this existed. But for those of you who are more visual learners, this may be a better way for you to actually learn, or memorize, recall what the cranial nerves do. What the cranial nerves do. So let's look at this. Cranial nerve 1 is your olfactory nerve. That is the sense of smell. So the 1 is placed in the nose position. If you notice, this looks like a face. This looks like a face, right? Cranial nerve 2 is optic, has to do with vision. So the 2s are where the eyeballs are. Cranial nerve 3 is oculomotor. So this helps to move the eyeballs. So cranial nerve 3 is around the eye. All right, so is 4, because that is also an eyeball movement nerve, and so is 6. The trigeminal nerve is the one that innervates the face. So remember, you have all of these nerves are bilateral. So your trigeminal nerve basically wraps around your face like this. And that's why this 5 is making up the entirety of the face. I already talked about 6. 7 is your facial nerve. This is the one that allows you to have facial expressions. So this is why the 7s are making up the edges of the face, right? The edges of the face. 8 is your hearing. 9 is glossopharyngeal. So it is your tongue in the back of your throat. Vagus is the nerve that starts in your head and goes all the way down into your digestive system. So this is why this is starting up here. And to me, this actually looks like it looks like intestines, and there's an arrow to tell you it's going down. So this is showing you where that cranial nerve 10 starts, where it goes, and some of the things that it innervates. 11, these are 11. So 11, remember, is allowing you to turn your head, flex your head, shrug your shoulders. So cranial nerve 11 is making up the shoulders in this figure. And 12 is your hypoglossal. So it's also a tongue nerve. So it is your tongue. So again, if you are more of a visual learner, then you can use this memory device to help you remember your cranial nerves. The next one is the one that will help you know whether or not these are sensory motor or both. This is a mnemonic that I actually use every time I talk about cranial nerves, because honestly, I don't use these in my everyday life. So I don't remember, or I don't often remember, whether they're sensory motor or both, because it's not something that I use on a regular basis. But I know this mnemonic. So some say marry money, but my brother says big brains matter more. You use this just like you use the other mnemonic devices at the that I showed you earlier. And when you write out OOOTTAF, etc., on the side of that, you can write SSMMBMB all the way down. So cranial nerve 1, sensory. Cranial nerve 2, sensory. Cranial nerve 3, motor. 4, motor. 5, both. 6, motor, etc. So that is how you use this memory device to help you remember whether these cranial nerves are sensory, motor, or both. All right, so hopefully those will help you remember these cranial nerves with more ease. I do realize that it's not the easiest thing to remember, but it's what we have to do. So again, hopefully these will help. These next 2 pages have images of the brain on them. So remember when I was saying that your cranial nerves are on your brain, and they're numbered from anterior to posterior. I'm going to stop sharing my screen for just a second because I want to show you something. So here's my brain. Now, when you're looking at the brain, this is the cerebrum. So this is the biggest portion of the brain. This is the cerebellum. This is the smaller portion of the brain. And then you have the brain stem here. This is the brain stem is what becomes your spinal cord. It becomes your spinal cord. So this is anterior. This is posterior. This is superior. This is inferior. Your cranial nerves are in this inferior portion of your brain. So here, trying to get my screen to stop moving. This right here, cranial nerve 1. This is ophthalmic. This is blunted, it's cut off, but these 2 nubbins right here are the beginnings of cranial nerve 2. They will continue on to go into the eyeball. So on and so forth. So cranial nerve 3 would be just posterior to that. Cranial nerve 4 just posterior to that, etc. So make sure that you are looking at I'm going to share my screen again. Make sure that you are looking at the images on here so that you can identify where each cranial nerve is and which cranial nerve is which when you're looking at an actual brain. So again, this is cranial nerve 1, cranial nerve 2, cranial nerve 3 and 4, and so on. All right. This first image is a drawing. So I wanted you to be able to see it very clearly. The next image is an actual picture of a brain. So this will make it easier to actually see what an actual brain looks like. It's numbered the exact same, it's labeled the same as the image before, but I wanted you to be able to see it on a real brain and a drawing so that you can compare and contrast the 2. Please make sure that you are looking at this. There will be a brain on your final exam, so make sure that you are familiar with this. Don't wait till the last minute to study it. There's almost no way, not to put anybody down, but it'll be really hard to try to cram this information in at the last minute. So please, for your own sake, make sure that you are looking at this and studying it now. All right. This last page is sort of your summary. The last page tells you, the first column tells you which nerve it is and the name of that nerve. The second column tells you the Roman numerals. So these are Roman numerals. The third column talks about the function. So it tells you whether it's sensory, motor, or both, and where it functions. All right, so this is the function of it. And this is how you test it. All right, so in class, what we were doing, what we've done this week in class is we tested each of the cranial nerves. So you have your sensory nerve, sense of smell. So you have your patient close their eyes, you waft something underneath their nose, and then you ask two things. One, can you smell this? And two, can you identify it? So you want to use things that are familiar. Don't try to go and use your Bath and Body Works, spring lullabies and candy rain and expect people to know how to identify it. And then when they don't, you say, oh, you can't smell, you failed the test. That's not fair. So what you're going to do is you're going to use common things like coffee, lemon, orange, lavender, for people who know what lavender are, vanilla, cinnamon. Use a common scent. But anyway it goes, close the eyes, waft it under their nose, ask them if they can smell it, ask them if they can recognize it. For cranial nerve 2, this is what happens when you are going to the eye doctor to get your vision checked. But for your case, we obviously know that this is not an official test. So we're not doing, we're not measuring things. Basically, what I'd like you to do is go to your phone, find an eye chart, pick an eye chart, doesn't really matter. Put the eye chart put the phone about an arm's length away from your test subject, and then ask them to cover one eye. Please don't forget to have them cover one eye. Have them cover one eye and then read the eye chart. You can have them start with the lowest line that they can read. And if they can read everything or with missing only one, then it's fine. If they miss two or more, then go to the one above it to see if they can read it. And that is how you test the optic nerve. For cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerve, this is basically how you do it. I know this tells you to have them blink, have them look down, have them look to the side, but the way that I learned it and a way that I think is most simple is to have your subject, and you probably did this when you went to a doctor in the past, you have them sit comfortably, look at an object in front of them, not without moving their head, follow the object with their eyes. So using this H pattern, you're able to test all 6 eye muscles, right? And so start in the middle, go to the side, up, down, side, up, down, and then back. And as long as both eyes can track and follow, then they did fine with that test. If you have a person who tries to track somewhere, like tries to look off to the side and say their right eye can't hold that position, the muscle that brings the eye over here is not strong, or the nerve is not strong, then while they're looking off to the side, this eye is going to slide back toward the center. And that's how you'll know that there's something going on with that particular muscle in that particular eye. That's why you want to take your time doing, doing the exam. All right, so that is oculomotor, the trochlear, and the abducens nerves. For the trigeminal nerve, remember there is a sensory portion and a motor portion. For the motor portion, what you'll do is you can put your hand on your test subject's jaw and then ask them to bite down. So when they bite down, the muscle that is allowing their jaw to clench should constrict, which means it'll get beefy, right? Just like your arm muscles when you bring your arm closer, this muscle is contracting, and the biceps is getting more beefy. Same thing here. And you should be able to feel that. But so sidebar, as a practitioner, you want to make sure that you are always testing both sides, because you want to make sure that whatever response you get on one side is the same response you get on the other side. And that can tell you whether or not that's normal for that person, or if you have a deficiency or excess on one side. So hands on both sides of the jaw and ask them to clench, and you should be able to feel that jaw muscle tighten. So that's the motor portion. The sensory portion, it says touch the forehead, cheek, and jaw line gently. So I only have a towel in front of me. I forgot to bring something before I started recording. You can use a cotton ball or a paper towel or something that's really light. What you want to do is have your test subject close the eyes, and then you take your towel or cotton ball or whatever it is, and you brush their face lightly in these 6 areas. Now, I want to tell you what to be careful for. As a practitioner, you want to be careful that you're not going in order, because your patient is going to start picking up the pattern, and then they're going to be able to just tell you, yes, I can feel it, because they have anticipated where you touch their face. People don't like to fail tests, even at the doctors, especially at the doctor's office. So make sure that you are doing a random order. So what you would do is have them close their eyes, touch part of their face, and then tell them to point where you touched. Right? So go through all 6 areas randomly, and again, light touch, have them tell you or point to the place where you touched, and then that can tell you whether or not they actually felt it. For the facial nerve, this actually says to have them smile, and that works well. The way I learned it is I actually would tell them to go through all the expressions. So smile, frown, puff out your jaws. And then when they're with their jaws puffed out, I might tell them to hold the air in your jaw, don't let me press it out. And so then I would take my fingers and I'd lightly press on their jaws. Basically, you're trying to check to make sure that their mouth muscles can hold that position against resistance. So you basically do this. And that's it. Don't slap their face. You're not trying to force you're not trying to force it out. You're not trying to overthrow their muscles. You're not trying to do any of that. Your job is basically just to see if their mouth muscles is strong enough to hold against that pressure. All right. With the facial expressions, you want to make sure that there is symmetry. This test actually is really important when you may suspect a person of having a stroke, because remember that with a stroke, you have people who have deficiency on one side of their body. Sometimes it's limited to just their face, and sometimes it is the entirety of that one side of their body. So if you suspect somebody of having a stroke, one of the things that you can easily do is have them smile. So if they're fine, they're going to smile and both sides are going to be symmetrical. If they're not fine and they're in the midst of a stroke or something else, it's going to be more like that. So you have the side that's smiling and the side that's sort of droopy because it's not being innervated by the nerve. All right. So that is the motor portion of the facial nerve. The sensory portion, you can test taste. So basically, if you had like a Q-tip with one that might have like some honey, the other has some salt, another one that had something bitter, you can put it on different parts of the tongue in like a very fine pinpointed kind of way and say, can you taste that? Tell me what it tastes like. For this test, we're not worried about that because I don't have it. Even in class, I didn't have it. So we're just doing the motor portion. So there's that. Vestibulocochlear, remember that is hearing as well as balance. So for the hearing portion, this tells you to have your partner close their eyes and snap your fingers beside each ear. And that's fine. You can definitely do that. Have, snap and ask them if they can hear it, or tell them they can tell you when they hear it, something like that. The way that I normally do it, the way that I learned, or one of the ways that I learned, I should say, is rub your fingers, right? Rub your fingers next to their ear, ask them if they can hear that. Usually they'll say yes. And then say, tell me when you can no longer hear it. And start to slowly move your fingers away while you're still brushing your fingers together. And if they can still hear it once your arm straightens out, so you're about arm's length away from their ear, if they can still hear it, their hearing is fine. You don't have to keep going across the room until they no longer hear it. Do it bilaterally, of course, and see if they can still hear it, and that's fine. So that is hearing. And then you have balance. You can have your partner, for the hearing one, of course, close your eyes. I don't know if I mentioned that, so make sure their eyes are closed so that they're not looking, because again, they don't want to fail a test. And so even if their eyes are face forward, they can still potentially see out of their periphery and tell you, oh yeah, I can still hear it, and they can see your fingers moving. They don't want to fail the test. So just keep that in mind. For the balance portion, you can have your partner close their eye, well, stand up first, then close their eye, and then stand on one foot. See if they can balance with their eyes closed. And then once they do that, move to the other side. What I need you to remember as a practitioner is that it is not a good look if you are telling a patient to do a physical exam and they fall and bust their head open while you have them doing a physical exam. So when you have someone do this, make sure that you are near them. So if this is the person, I'm going to stand close to them and I'm going to have, and I can't do it right now because obviously I have this in my hand, but say the person is standing here, I'm going to be like this, right, with my hands in front of and behind them or on either side of them, whether the person is like this or they're like this, it doesn't matter. But I'm going to be here with my hands up, ready to catch them if they start falling. Because again, it's not a good look if your patient falls and busts their head open because you told them to close their eyes and stand on one leg. All right, so keep that in mind. That is cranial nerve 8. Another sidebar. You know what? I'll talk about that later. So glossopharyngeal, we're not doing taste, but for the motor portion, all you have to do is have them swallow, so they can just swallow their saliva, and you're just going to make sure that you're looking to see if this all moves. Because if they say that they swallowed and they didn't, and all they did was some movement of their body, but their throat didn't move, then that might be a problem that you need to refer the patient to get checked. The vagus nerve, you've probably already checked their vagus nerve when they came into your office. So when you're in clinical practice, of course, because you've already done pulse on them, but you can also feel their pulse just to make sure that you can feel it. And if you can feel a pulse, they're fine. The accessory nerve, remember this is the neck and shoulders. So the easiest thing to do is tell them to lift their shoulders or to shrug their shoulders. Now, the way that I learned it, the way that I actually like doing it is have them go into this position and then say, I'm going to press down on your shoulders. Don't let me push you out of this position. And then take my hands and put a little bit of pressure on their shoulders to make sure that they can hold that position. Now, again, you're not trying to overpower the person at all. You basically just want to make sure that they have enough strength that they can withstand a little bit of pressure. And you're checking to make sure that they can do it bilaterally. Because if they have a deficiency on this side and you try to push and this side is fine, but this side immediately drops, then you know that there's a problem on this side. All right, so that's the bilateral nature of it. You can also have them turn their head side to side. You can have them laterally flex, right, just to check the accessory nerve. And then hypoglossal nerve, have them stick their tongue out. Their tongue should be midline. So just like mine was, it should be midline. Now, this is another test that is really good to do with a person who you suspect might be having a stroke. because if there is a stroke that is affecting one side of their body, remember the nerves are all bilateral. So if you have a deficiency in this side, but this side is strong, when they stick their tongue out, it should be midline. But if there's a deficiency on this side, the tongue is going to deviate to that side because there is nerve conduction going on this side and not on this side. So these muscles are moving and this one is not. That would be like if you had a table that needed to be moved from one side of the room to another, and you had your little brother who has, been playing football for like the last 5 years and goes to the gym 5-6 days a week, kind of beefy, very strong, and your grandpa who is an elder who's pretty weak. He's not able to move, but he really wants his table moved. So when someone says, all right, now lift, when they lift the table, the side that your brother is on is going to be lifted very fast and very high in comparison to the side of the elder because there's not as much strength on that side. That's the same principle. So the table would be like this with the side that works and the side that doesn't. And with the tongue, when you stick it out, if this side is deficient, the tongue is going to deviate to the side that is deficient, all right? Because there's no nerves, there's no nerve innervating the muscle, so there's no muscle strength that's actually pushing that tongue from the side, straight. So that's how you're looking at it. This also says you can just have the person say hypoglossal because it's a complex word. So honestly, either one of those, but for me, it's easier to just have them stick out their tongue. But you don't have to do both as a practitioner. So that is how you test all 12 cranial nerves. What does that say? That's how you test all 12 cranial nerves. Oh, keep in mind that when you do get into nursing school or whatever school that you're about to go into, when you learn how to do physical exams, there are several different ways that you can test each thing. So you may not get this exact list as you're learning to test your cranial nerves, and that's okay. I just wanted to introduce you to it, but I just wanted to put it in your mind that you may not necessarily see these exact same tests or see them in the same way as you do right now. All right. That is it. Actually, there's one more thing that I meant to tell you. Same sheet. So the number 8, this is about Roman numerals. So this is the number 8 in Roman numerals. You can also represent the number 8 in Roman numerals by having IIX. So IIX is the same as VIII. On this page, I have VIII. On the answer sheet that is also listed on Canvas, it is IIX. I just want you to know that that's the same thing. Both of them represent 8, so you don't have to get confused. I didn't forget anything. I just wasn't looking at one sheet when I was making up the other sheet to keep it consistent, all right? Last thing is that on the answer sheet that is also on Canvas, you'll notice that there are blank spaces for all 12 of the cranial nerves. This is where you write your results. Now, also on that sheet just above that, you have 2 examples of how to chart cranial nerves. How to chart cranial nerves. Now, matter of fact, I'm just going to open up the document. Now, I have put the 2 examples on the page because I want you to see what actual charting of cranial nerves looks like, but I'm not expecting you to automatically know how to do this because I realize you haven't learned how to chart at all. But what I would like you to do is use these 2 as an example of how to chart so that when you're writing your results here for each of the cranial nerves, and remember I was telling you about cranial nerve 8, that means 8. It just looks different from what it was before. When you're charting each of the cranial nerves, I want it to look more like this. So write out your findings. I do realize it's probably not going to be correct charting, and that's fine. we're not putting this in a patient chart. I just want you to get, I just want to see what you do and get you exposed to it. All right. So that's it for the cranial nerve lesson. Because you were not able to come to class today, if you would like to come to class and do the cranial nerve experiment or the lab in lab, then you're welcome to come to my Thursday class. I have class on Thursday from 5:30 to 8:30, 8:20. So you are more than welcome to come to class and actually do the lab then. Otherwise, you can go ahead and do these at home. These are pretty simple. You can choose a roommate, a parent, a sibling, your classmate, whomever you want, but just do it. Be mindful of the due date, of course. And I think that's it. So have a great night, and I will talk to you soon. Bye.